patient, very jeune femme. Don't have big lassity, don't have big problem, but you can improve quality of the skin and a little bit make lift effect a little bit in this part. Nous pouvons utiliser le double needle et nous pouvons avoir ce petit mouvement. Mais c'est très jeune patient. For mandibular area is very important you make the point, safety point. And the first point, you touch the angle of the mandibular, of the bone. When you touch the angle, you can 1 centimeter and half or upper, you can make this point. This is my start point. Okay? Remember, we use a double needle. Double needle is a thread with two needles at the start and at the end threads. With the first needle, we enter in this start point and go parallelus mandibula until an exit point. You can find this point or immediately after or immediately before marionette line. I suggest you, if you have a big ptosis, big marionette line, I suggest you exit immediately before. If you have a little bit ptosis, you can choose. It's the same. Okay? And exit in this point. With the second needle, I enter in the same start point and go parallelus mandibular upper. In this way. Until here. Okay? And exit. The first parallelus in this way. The second in this way. This is an easy technique. Very, very fast technique. Very easy. Mandibular. When you found 1 centimeter and half more upper, start point. Parallelo. The second needle. Okay, exit point. I cut the threads, it's finished. Okay? Sorry? Okay. In this case, I use local anesthetic only in the start and exit point. Only this point. I prefer use local anesthetic with adrenalina or norepinephrine. In this way, I have vasoconstriction. Without blood, I see better my hole. Why? Remember, in start point, I need to enter 2 times with 2 different needles. It's very important I enter in the same start point. Okay? For this reason, I before open a little bit the start point with 18-gauge needle. Enter perpendicular, I open a little bit. In this way, I'm sure, I see, good evening, I'm sure I a bit, un peu. Un peu. Ok. Un peu. Ici, un peu ici. We start from this part. Only local anesthetic is better. No. Yes. My start point in this way. Okay? You feel pain? Tartoricimo? No, tartoricimo. Perpendicular in this way. This is the same movement with the needle, or the double needle. Enter perpendicular, open a little bit in this way, open a little bit. After I make this movement, one, I come back without exit, turn a little bit, and make the second line. Okay. Why this is very important? If I enter in the same start point with two different needles, but I go with the needle number one in one level, with the needle number two in the level different, I can obtain a depression. In this way, I before prepare my way in the same level, and after is easier when I enter. Okay? In this way. Now I can remove. Voilà. Voilà, les jets sont faits. Okay. This is anesthetic, for the anesthetic. Okay. This is double needle. Double needle, in this case, we use double needle 12. In the middle part, there is barbs. Okay, is smooth, perfect. Okay, and now we go. The same movement, the same movement. Perpendicular, immediately parallel, in this way. Without hand, okay. But I suggest you enter, immediately you make a check. How? In this way, pull and touch. If you feel too much needle, this means you stay more superficial. If I go more deeper, patient feel pain. Immediately, you understand, you make mistake. Come back a little bit and go in the correct level. If I go more superficial, I have this situation. I see white area, because I stay more superficial, compression, vasoconstriction. If I don't see white area, I make this wrinkle. This means I stay more superficial. Don't worry, come back a little bit, check, and go in the correct level. If you want to improve your lift effect, you make this movement during your procedure. I go. Check. It's very important that you make check step to step. Why? I enter in the correct point. Stay in the correct level. Check one time, it's good. But after it's possible I go more deeper or more superficial. In this case, when I make this check, I don't feel one line, but I feel, understand I make mistake, come back a little bit and go in the correct level. Okay, now I can exit. It's very important when you exit, you stopping a middle part without barbs and stopping in this point. Okay. The first check, if now I pull a little bit, if I go more deeper, the threads come out. Because if you stay more deeper, the barbs don't attach. But in this case, I stay in the correct level. Now, with the second needle, I enter in the same start point. But pay attention, move a little bit the threads, because it's possible you enter and you cut the threads with the needle. For this reason, you move a little bit threads, enter in the same point, and go immediately. Enter, exit. Now, very important, in this part you don't make node. Okay. Okay. Now I suggest you don't cut. Cut only needle, but no cut all threads. Why? It's better if you put threads also in the second side. After you can study the perfect symmetry. When you are sure the perfect symmetry, you can cut. Thank you so much. Open the same start point. In this way, I take in this way, pull. When I make this movement, I feel very good. My needle, I see very good where is my level. It's impossible I go more deeper. I take in this way, make this movement perpendicular, remove here, open a little bit, okay, make the first line and check without remove, turn and make the second, just a moment, okay, this is my, okay, and make the second line. Okay, perfect, okay, stopping a little bit. Okay. The same operation. Sorry, doctor. Okay, I in this part. Thank you. Okay, perpendicular. Okay, perpendicular. Immediately parallel. When you enter perpendicular, you feel you like the step. You enter, you feel under finger, tack. This is good level. Make shake. Sorry. Make shake. Make shake. You feel pain? No. If I go deeper, you feel pain? Okay. Okay. Okay, perfect. I check, okay? The threads don't come out. It's perfect. You feel the sensation of traction. Yeah. Now I move to don't make in front the same start point, perpendicular. Immediately I move. I go in this way. Check. 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 Okay, I can exit. Thank you, doctor. You are precious. Okay, now we can cut a little bit needle. Thank you so much. Now the patient, vittozi, big vittozi, but the movement is the same, or in this case, or when you have the older patient with the big lassity, you stopping the threads and make this movement in this way, in the one and the second part, in this way. Okay, you can make this movement in this part and in this part. Okay, if you, sorry, Stefania. Okay, if I pull, you can see the power of the threads. Look, and work not only in this part, but also in the neck. Okay, but in this case, don't need pull too much because it's a young patient, Stefania. Okay, well, now we can cut. When you cut, it's very important. You pull, push, and cut. And after you feel, if you cut very good, you don't feel needle. And you pull and cut. Okay.
جان یک مقداری بله. فقط دقت کردید که چون از سگینگش خیلی کم بود این بر نگشت. شما اگر بخواید فارموزیس پهن ایجاد بکنید بهتر برگردید. چون 23 و 12 از نظر گیج هیچ فرقی با هم ندارن. وقتی شما 23 میزدید بینید و برمیگردید دو تا باند موازی هم براش میزدید تا فارموزیس ایجاد بشه. ولی خب این نیازی نداشت. خیلی
In this point, you can see a little depression. Okay, but little. This is only because before we inject local anesthetic. But if you have a patient with big laxity, after is normal in this point, you have a little bit more depression. More laxity, more wrinkles in this part. You can cover with strip and after 1 week disappears. You don't have, but it's very important to cover. If you cover, patient don't see. If patient don't see, your phone don't ring because patient don't have problem. After 1 week, when patient come back in your office, you don't have problem. Patient happy, but you are more happy because you stay very relaxed. If patient doctor,